Today we're going to get into a day in the life of the nurse practitioner student. Let's go. What is up, everybody? What's happening? APN Student Kev here, just about on our way to clinical and one of our last days. So I'd like to show you guys what it's like. Unfortunately, I can't show you all the struggles that came in between how we got here, but you'll still see a good routine that we have, I guess. I won't be able to bring you guys in the rooms. However, I will try to explain everything in between. So without further ado, let's go. NP student live here. Oh my God. As you can see, we can either wear scrubs or, like me, we can wear decent clothing. So somewhere in between. Obviously, you gotta wear your lab coat. I recommend not to ball out on a lab coat. Just get like a $20 one from Cherokee, or if you had one in the past, just use that because nobody cares what kind of lab coat you have. Anyways, we're heading to our primary care clinical site. So just a measly 5 minutes away, which is very nice. So yeah, let's head out. All right, guys, so we made it. Like I said, measly just 5 minutes away. We're expecting a very busy day because it is Monday, but one of our last days. Let's go. Ready? That's not good. Blood pressure.
Oh my God.
That's not good. Is that yours?
That's not mine.
This can lead to this, according to Pfizer, 2006. Very fitting. All right, guys, so we made it to the office. Right now, we're in an exam room. Typically, you would check the waiting room, see who's in there. Right now, nobody's in there. Otherwise, of course, I'd be seeing a patient. However, the typical routine is you grab a paper, you bring the patient back to your room. You know, you sit them down. Hey, how you doing? How's it going? How can we help you today? They'll let you know. That's where you, of course, document your chief complaint, any pertinent history, especially anything that's happened since their last visit. Do your assessments, take a look at their meds, go through the meds together, and come up with a plan of care. And in between, you're, of course, doing vitals. It's really hard to just talk to the patient without documenting. If you don't document while you're with the patient, then you're gonna get stuck behind. You're gonna be here all day till about 9 p.m. at night. And nobody wants to do that, especially as a student. They're gonna kick you out. We're very lucky at this facility. The doctor here, or nurse practitioner, basically lets us kind of do our own assessments. We gather as much information as we can, then we present the case to the APN or the doctor, whoever's here, and basically tell them what's going on, what we think they need, and we come up with a plan of care together. So it is a good system here at this site. Turns out the doctor is actually not here. He's in Peru, so good for him. I miss you, Dr. Sinha. I don't know if I'll see you again, but I hope I do. While it's slow, I guess I can show you around the room. So here you have your needles. We give a lot of B12 shots here, your tongue depressors, your alcohol swabs, Q-tips, to assess wounds, you know, ears, things like that. Here you have a lab slip in case you need to send a patient for some blood work. We use those quite often, or we send it through the computer if they have to go to LabCorp. Gloves, soap, of course. I'll try to fix this for them. That's just hanging on there, but that's all right. You have your exam table there, a couple chairs. I don't think this thing works. No, but I guess you could read an x-ray here if you really wanted to, in case somebody brought their films in. And we're doing old school blood pressures here, which is fine. It's always good to get your practice in. You have your typical generic old doctor posters here. Let's see when this is from. 2017, not bad, we upgraded. But yeah. Very typical doctor's office. Makes you feel right at home, or right when you were a kid. All right, guys, so for our documenting purposes for our university, we have to go into e-logs and basically just put in your information, what class it's for. You put some patient demographics, of course, without putting any identifiers. The purpose of the visit, typically it's an office visit. You scroll down, any procedures that you did, you know, for OB, maybe you'll do an ID insertion. For here, maybe you're doing some cerumen removal. I've seen that once or twice. Typically not too many procedures done, not as often, in the primary care setting at least. But you could also put in your diagnostics that you ordered, you know, your blood tests. Maybe you ordered an MRI, mammogram for prevention screening, of course. Whatever, we'll keep going. And PHQ-9 if they're an annual and they're Medicare. You click next, yeah, it's gonna tell me I'm missing all this stuff. Here you can put the systems that you assessed, typically vitals, you know, psychiatric if they're on antipsychotics or benzodiazepines. Also, you would do your cardiac and respiratory, of course, always. MedRec, GI, you know, musculoskeletal pain, etc., depending on what they came in for. Here's where you would put your interventions that you carried out. You know, diagnostic testing, if you ordered any, disease-specific screening, teaching, understanding, you know, a lot of education that we do, medication management, did you initiate a medication? Then you go in, you put your CPT code. Typically here, it's always 99214, unless they're a new patient, or of course, unless you spend a great amount of time with them. After that, you can put in your ICD-10 codes. These are just some common ones. Obviously, the most common would probably be, in my opinion, hypertension. Then we have to put in medication codes like calcium channel blockers. And type that in, that goes there. Usually they have multiple chronic but controlled diseases. I'm in my senior year of APN school, so I put mostly student, obviously because I didn't do everything. And this patient, they were able to walk into the facility, so we'll put no impairment. And you could submit it, but I'm not gonna submit this. I don't think anyone's here yet.
I don't think so either.
Yep. All right, guys, no one's here yet. So we're gonna start doing televisits. Usually we put those at the end of the day so that the people here don't have to wait. Usually this is done through an iPad, as you can see. Great way to see patients that don't need to come to the office for things like medication refills. If they have COVID, that was a big thing. So yeah, we're gonna see what this person needs. We're gonna try to help them out and save them a trip to the office. All right, guys, so the televisit was done. Turns out he had sinusitis, but also was there for a medication refill. So we're able to refill those medications, do an assessment through the iPad. So that was that. That was fairly quick, which is good. So let's see who's in the waiting room. A few more patients. Let's keep going. Working hard or hardly working?
So yeah, so the visit code. Working hard.
Yep. We're about halfway through our day. Saw a few patients and we're just going through the motions. Got some more e-logs to do. Typically do about 8 per clinical. We gotta wait to see what the rest of the day holds. We got about 15 people left, so we're halfway through.
Thank you.
Thanks, Catherine.
See you Thursday.
See you Thursday. Oh, she's busy. Bye, Rafi. Later, man. Alright guys, so that wraps up our day. It was quite an anticlimactic day. Busy for the nurse practitioner, not so much for the students. But yeah, had some annuals, had a sinusitis, a lot of med refills as usual. How about you, Liv? Anything?
Nothing eventful.
Well, sometimes that happens, which is good. We don't want any issues, obviously. But that about wraps it up. We'll see you guys back at the crib and talk about our day. See you guys soon. Alright guys, well there you have it. I tried to show as much as I could at the primary care office, but that is somewhat of a day in the life of a nurse practitioner student. Typically you do see 6 to 10 patients per clinical day. Obviously that varies depending on how busy the doctor is, how many doctors they have. But like I said before, essentially it is the same routine over and over again. You get the patient, you ask them what brings them in, and then you go from there. You do vitals, your assessment, come with the diagnosis, come up with a plan of care, you educate, and you make sure all their issues are addressed. Obviously, when you're done, you present the case to the provider, and again, you both come up with a plan of care for the patient. Now that we're in our last year, I can tell that the providers agree with us much more. Could be because we're more confident with our plan of care now as opposed to when we first started. Clinical days truly are somewhere in the middle of nursing clinical and a residency program for medical students. Obviously not anywhere near as many hours as medical students. For our university, they expect 300 clinical hours per semester. So that's about 3 times a week for close to 14 weeks. For me, I still had to work and pay the bills, so going 3 times a week was more than enough, because I still had to work the other 2 days a week. So still a 5-week work day plus assignments and studying when you can after. I personally work 9 to 5 as an infusion nurse, so I was able to find out a routine that works best for me. I say that it's similar to nursing clinicals because you're still doing a lot of education. You're still assessing your patients like you would as a nurse. And for now, you're still collaborating with a provider. Now, of course, the main difference is you're able to prescribe medications, not as a student, but you are able to make recommendations, especially when it comes to dosing, as opposed to just saying, oh, I think they need something for their blood pressure. Now you take the next step. Oh, this patient would definitely benefit from a water pill. So it is a new role, it is a new routine, but you are able to put both worlds together. Everything I've learned in my nursing career, I'm able to put into this new role as a mid-level provider. And although the clinical days are coming to an end, I know this is only the beginning and I have a lot to learn, but I am very excited for this journey. So if you guys want to see more content about this APN journey, please continue to follow us on YouTube or on Instagram at Supreme Scrubs. Again, my name is Kev and we'll catch you guys at the next step. Peace.